ASQ, and Certified Professional in Healthcare Quality CBHQ, Certified KBI Professional and Practitioner CKBIP from KBI Institute. She has conducted an exploratory research and evidence-based management in Saudi Arabia in 2013 as the first study conducted in the area. She is an author for a book chapter titled Approaches to Evidence-Based Management and Decision-Making in Healthcare Organization, Lessons for Developing Nations. Book title Transforming Public Health in Developing Nation, and has other published articles in the field. I'd like to welcome Snof, and you can start your presentation.
Their findings. After that, they present all these findings in the report and the corrective action to the committee, the accreditation decision committee, and they can decide or grant the accreditation. After that, we continue with the maintenance process. All accredited organizations, they go through maintenance, and they have to complete the self-assessment, what we call it midterm self-assessment, and they have to report to CBAHI any sentinel events or significant changes. Also, we have for maintenance a random survey visit. We select 5% randomly from those accredited organizations to be visited unannounced. Sorry. After that, the cycle for the accreditation is 3 years. After it's finished, the organization will start the next cycle. CBAHI also provide different tools to assist healthcare organizations to be accredited. Those are like orientation programs, and each accreditation program has specific training program. We also have standard manual, accreditation guide. We can conduct mock surveys, and we have the frequently asked questions in our portal, and of course we have direct contact for any assistance required. Now, CBAHI programs and laboratory standards. I think everyone knows about the published study by CDC that found around 70% of the medical decisions depend on laboratory, which means the importance of the role of laboratory for the patient care. Therefore, CBAHI has included the laboratory standard in all its programs. For hospital program, laboratory standards have the largest portion. The laboratory has 76 standards, which is around 18% from the whole standards for the hospital, which is almost equal to the standard for all medical services in the hospital. And yet still it is a more scoreable element than other specialties. For primary healthcare standards, we have 22 chapters. One of them is for laboratory, and we have 11 standards, which is almost 5% from the scoreable element. And of course, in primary healthcare, we have only basic services in the laboratory. For the ambulatory care centers, we have 11 chapters. One of them is laboratory, and it has 12 standards, which is around 14% from the standards. We also have a MAN, or we call it ESR program. ESR is 20 standards. Those were 20 standards were selected from the hospital program based on their severity and the sentinel events. 2 of these standards are for laboratories, PC25 and LB51, which are concerned with blood transfusion. And finally, we have laboratory program. This book is targeting 2 types of laboratories. First is the standalone laboratories, and for hospital-based laboratories. And for hospital-based, for only those laboratories provide services and blood products to other healthcare institutes. The book has 133 standards. Those were designed to cover the 12 domains of the quality management system for laboratory, or what we call it quality system essentials, which are the organization, customer focus, facilities and safety, personnel, purchasing, equipment, process management, documents and record, information management, non-conforming events, assessment and continual improvement. We also have 31 certified CBAHI surveyors. Those were selected from the main surveyors, and we assigned from 1 to 2 surveyors for 1 or 2 days survey visit based on the size of the laboratory and the scope of service. Regarding the scoring for CLBB, it's unlike the other CBAHI programs. There is no scales for the scoring. It's either met or not met. And the laboratory has to reach 100% compliance in order to be accredited. If the score is 75%, the laboratory will be given 2 months to correct the findings. If less, the lab will be denied of accreditation. Now I will show you some of the facts and findings. Those estimated market size. We have around 450 hospitals and 2,500 primary health care and around 2,900 ambulatory health care centers, and for laboratory 130 private labs and 15 regional laboratories. Those are for MOH. So in total it's around 6,000 healthcare facilities. For CLBB program, we have 111 standalone laboratory registered with us.
Can we wrap up in 2 minutes?
Yes. Okay. So then I will show you the accredited laboratory is 58%. This slide to show you the compliance rate in the hospital program, and this slide show you the laboratory in comparison to the other specialty, which shows it's the least compliant comparing to others. This is also the standards. If you need me to finish in 2 minutes, I will skip those slides. Just to mention those, the main standards there were not in compliance with for the most laboratory we have visited. 67 of the laboratory we have visited is for process improvement and validation critical equipment, emergency and disaster plan, deviation and exception, change control, and proficiency testing. So I will skip the other standards. This to show you the improvement we found between the first cycle and the second cycle. And here was what happened in 2020 as we all faced the pandemic of COVID-19. CBAHI has stopped all the visits for all programs in March, and we conducted a special visit for to survey the preparedness of the hospital in dealing with COVID-19. We prepared a visit package that was focused on infection control standards, and they were targeting emergency room, inpatient, and hemodialysis. We visited the hospital in 3 waves for different hospitals, and after that we revisit the same hospital after the corrective action. The score for the preparedness visit was on 3 levels: high, intermediate, and low. And here to compare the visit and after the correction, it was only 24% of the hospital prepared for COVID, and after the second visit, it raised to be 53%. This is a comparison between the private sector and government sector in regard of the 3 areas of emergency, inpatient, and hemodialysis. After that, we resumed our visit in CLBB in July and the hospital in September. However, we have changed some of the process for hospitals. We now only survey 30% of the scorable with the ESR to be 1 day in order to accommodate the circumstances that we have. Of course, we did piloting and testing to make sure this new methodology is effective, and now it's adopted by CBAHI. For CLBB, we have added 4 new standards based on the ESCWA requirements. Those are credentialing, privilege, risk management, and governing responsibilities. We also stopped visiting the hospital-based laboratories in 2020, and we were focusing only on the hospital-based, the standalone. We prepared all the survey process for the new standard book, the ambulatory care centers, so that we will start our visit in January 2021. Also, we worked with the new programs that will be published soon. And finally, the CBAHI is going under changes for improvement that will be announced once it's finalized. So in conclusion, CBAHI is the official national agency that accommodates all circumstances to provide the needed changes. It provides standards that to enforce implementing complete quality management system in all healthcare organizations that will simplify work, eliminate errors and wasted resources, and of course this will improve the quality and patient safety, and it will lead to community confidence and customer satisfaction. Thank you.
Thank you so much, Ms. Nof, for your excellent presentation about CBAHI. And really, we are proud about CBAHI, and I wish you all the success.